For first-time parents, or for those who need reminding on the stages of labour, this video is for you. I'm Lizzie and I'm an antenatal hypnobirthing teacher, and I'm a mum too. In this video, I'll be explaining the stages of labour and what you can expect. It's really important to know that the length of labour varies for all women, but the physiological process is very much the same. Signs that you might know that you are in early labour are period pain cramps, which could suggest contractions. Your waters might also break, which could be a big gush like you see in the movies, or it could just be a little trickle that continues for quite a while. You might also lose your mucus plug, and you might spot this in your knickers or in the toilet, and it looks a bit like a jelly-like discharge. The early labour stage can last from a few hours to a few days. Although it might seem like very little is happening, your cervix is becoming shorter and thinner, a really important part of the process. You will experience contractions that feel like period pains, but at this point there might not be any pattern to them. It is really important for you to carry on the rest of your day or evening as normal. Try to rest where you can, keep hydrated, but you might feel like doing some gentle exercise where possible. You are far more likely to progress onto the next stage of labour if you are feeling calm and relaxed, so it might be worth thinking about those hypnobirthing techniques to help you get into this zone. You will know that you are in active labour when you are having more regular contractions, perhaps every 3 to 5 minutes. This does mean that you will have plenty of time in between them to rest. Eventually, you might want to start timing your contractions, and you can use apps to help you with this. When you're having about 3 contractions in a 10-minute period, each one lasting between 45 and 60 seconds, you are in established labour, and you might want to phone your midwife to let them know this. They will encourage you to stay home for as long as possible, and research does suggest that the longer you are able to stay home during this stage, the more likely you are to progress through your labour and have a straightforward birth. Each time you experience a contraction, your uterus muscles are drawing upwards, and by the end of this stage, those muscles will be at the very top, ready to help push your baby downwards, and you will be about 10 centimetres dilated. At this point, you go through the shortest stage of labour, which is called transition. It might last between 10 to 40 minutes, but for many women, it is where you experience the strongest sensations. You may feel like at this point you can't cope because there are less breaks between your contractions, but just keep in mind that you are so close to birthing your baby. Now it's time for the birthing stage, where the uterus muscles are at the very top, ready to push your baby downwards. You are likely to experience a crowning sensation, which is where your baby's head is moving forwards and backwards. Imagine a U-bend in a pipe. They're taking 2 steps forward and 1 step back, but eventually they will be ready to be born. Once baby's head is out, labour may pause for a little while, and this is so that baby can turn to get into the most optimal position. Please don't worry if you are in a birth pool at this point, because your placenta is still doing its job in providing oxygen for your baby. Once your baby has turned to make the most amount of space in your pelvis, with your final contraction, your baby will be here. While you are hopefully having your first lovely skin-to-skin contact with your baby, your placenta will be ready to be birthed. You have a couple of options here. You might choose to take the managed 3rd stage option, and this is where you are given a synthetic oxytocin injection, which encourages your placenta to come out. Some women may find this uncomfortable, as your midwife will need to apply some pressure to your tummy and gently pull on the umbilical cord. A managed 3rd stage is recommended after an assisted birth using forceps or ventouse, and this is because there is a slightly higher chance of bleeding, so the synthetic oxytocin injection will prevent this bleeding. The second option you have is a physiological third stage, which is where you wait for your placenta to come out naturally. This can take up to an hour. As always, do your research and ask your midwife any questions that you have about the stages of labour. I hope you have a really positive birth experience.